A Pablo Escobar mask, 70s disco shoes, and a list of reasons a drug can be scheduled in the U.S. These were just some of the visuals from the panel, Perspectives on Drug Scheduling from two lawyers who took on the DEA, presented on day one of Psychedelic Science. Attorneys Brett Phelps and Robert Rush used these images to highlight the bizarre and often arbitrary ways the DEA categorizes substances under the 5 schedules of the 1970 Drug Abuse Act. The pair recently challenged the DEA in court over its proposal to place psychedelic research chemicals DOI and DOC in Schedule 1, the most restricted category. Here's Gina Giorgio, Director of Strategy and Development at Students for Sensible Drug Policy and moderator of the panel, with more.
Well, I think that their drug scheduling rationale has been pretty consistent since the passage of the Controlled Substances Act. So it's really easy to put a drug into Schedule 1, but it's really hard to get a drug out of that placement. And we're seeing that with FDA clinical trials. It's taking actually millions of dollars in years to just get a drug shifted from Schedule 1 to Schedule 2.
DOI and DOC are chemicals being used in research studying serotonin receptors and have little to no proof of recreational use of any kind. This case could set an important precedent for those seeking to petition the scheduling of other research chemicals.
So this is the first time that harm to research was formally considered in a drug scheduling case. And I think that it shows an evolvement of that. We've seen prohibition of psychedelic research for decades, and so that's really what we're pushing back on.
On June 20th, the final day of Psychedelic Science, and 2 days after this interview was filmed, a Drug Enforcement Administration judge formally recommended that the 2 compounds be placed in Schedule 1 of the Controlled Substances Act. SSDP has released a statement stating that they are preparing an immediate legal challenge and will explore all avenues, including appealing the DEA's final ruling.